And in studio with us today, we have the director of the John C. Lincoln Breast Health and Research Center, Sherry Gage. We also have four new people in studio with us at present time. We have Dr. Linda Benaderet. She is a medical oncologist. She has practiced medical oncology in Phoenix for 25 years. Most recently, she specialized in breast cancer oncology. She is presently on a sabbatical, but is spending time with us today. Dr. Benaderet will be affiliated with the John C. Lincoln Health Network after the first of the year, and stay tuned for new and exciting plans along that end. We also have with us Dr. Brenda Murty. Dr. Murty is a fellowship-trained breast surgeon. She completed medical school back from my stomping grounds at Kansas City University. She had general surgery residency at Maricopa Medical Center and focused training in breast surgery at the University of Southern California. She started the Comprehensive Breast Center of Arizona in 2005, which is located in Peoria, Arizona. She's co-authored journal articles published in the American Journal of Surgery and a book chapter on ductal carcinoma in situ, which is cancer that involves only the place in which it began and has not spread. Carcinoma in situ is an early stage tumor, I understand, correct?
That's correct.
All right. Then we have Dr. Murali Murty, spelled differently, pronounced the same as the other Dr. Murty. Dr. Murali Murty has his Bachelor of Science in Electrical Engineering from Rutgers University, a Master's in Public Administration with a focus on healthcare management and finance from New York University. He earned his Doctor of Medicine degree from the University of Medicine and Dentistry in New Jersey Medical School. Completed his internship in internal medicine and residency in radiation oncology at Drexel University College of Medicine in Philadelphia, where he served as chief resident. He has trained extensively and done research in the treatment of breast cancer, including whole breast and accelerated partial breast irradiation via high-dose rate brachytherapy, which I don't have a clue other than I found out that it is a form of radiotherapy in which sealed sources of radioactive material are inserted temporarily into body cavities or directly into tumors. And I saw a whole video on this not too long ago. Amazing stuff. Dr. Murty is also extensive experience and training in state-of-the-art cancer treatment technologies, including IMRT, IGRT, we'll find out about those, 3D conformal radiation, cyberknife, and Linic-based stereotactic radiosurgery and tomotherapy. Whoa, folks, put your tongue around that one. After practicing breast-specific as well as general radiotherapy and stereotactic radiosurgery at AOS in Phoenix and Central Indiana Cancer Centers in Indianapolis, he is now joined with the Arizona Breast Cancer Specialist. And then also, last but not least, we have Dr. Pablo Pritchard, plastic surgeon, breast reconstruction. Born in Buenos Aires, Argentina, his family emigrated to America when he was quite young. He graduated with honors eventually from Rice University and the University of Texas and Galveston Medical School. Completed his general surgery residency and plastic surgery fellowship at Michigan State University, which is known for being the first integrated plastic surgery program in the country. Dr. Pablo Pritchard is the senior partner in Advanced Aesthetic Associates, PLLC, and Advanced Plastic Reconstruction, PLLC. He is the medical director and chief of the Plastic and Reconstructive Surgery Department for John C. Lincoln Hospital. Dr. Pritchard has authored many journal articles on plastic and reconstructive surgery. So welcome to each and every one of you. Thank you once again for taking your time off, or taking time off to spend time with us and on this very, very, very important topic. Thank you. Now then, let's do this. Let's start off with Dr. Murty, Dr. Brenda Murty. What are the surgical treatment options for early breast cancer?
Fortunately, there have been a lot of advancements in the surgical treatment of breast cancer. So prior to the 1970s, we were still doing radical mastectomies, which includes removal of the breast, the skin, and the muscle, leaving women very disfigured. Since that time, there's been a lot of data showing that we can actually treat early breast cancer with breast conservation. So what that means is that you can remove the tumor with some normal tissue around it, add radiation therapy, and the overall survival rate is equivalent to a mastectomy, which is removal of the breast cancer, the breast tissue, and you can save the skin overlying that breast and then add reconstruction if that's the woman's choice.
All right, let's do this. We've had a caller holding on the line quite patiently for some time. We have a lady by the name of Rochelle in Spring Valley, Arizona. Rochelle, you're on Main Street Out Loud. What can we do for you today?
I'm calling on behalf of my sister in Las Vegas, and I would like to know if there's 3D mammography available in that area for her.
In Las Vegas?
Yes.
I can take that question. You can go to hologic.com, HOLOGIC, and it'll tell you all the centers that have 3D mammography.
Can you spell that, please?
HOLOGIC.com.
Okay, and does the 3D mammography put out less radiation than the 2-1?
Actually, the radiation dose for 3D mammography meets the same requirements as 2D. It is higher than 2D, but the benefits of having this procedure far outweigh that. The government sets a rate of 3 milligray that you cannot exceed no matter what technology you use, and it is below 3 milligray. 2D imaging is slightly lower than 3D, but it is definitely more beneficial to have the 3D.
Okay, and does it still require you to have what I call breast squeeze? You can use the term you want for what I'm talking about.
Does it require that you have your breast squeezed?
Yes, it is actually the same exam to the patient. Hopefully they can compress a little less. You actually can add no compression, but the reason they compress is to reduce the radiation level you're receiving. The thinner the breast tissue, the less radiation that is used.
I see.
All right, Rochelle, thank you for your question. Folks, we have to take a quick break. This hour is going to fly by. We'll be back in just a moment. You're listening to Main Street Out Loud. I'm your host, Rudy Kay. Back in a moment.
There is nothing so sentimental and breathtaking as handcrafted custom jewelry. Whether a family heirloom passed down from generation to generation or a unique modern design, it's special and it deserves professional care. Family-owned and operated Haney's Family Jewelers in Gilbert is the home of custom-designed and handcrafted jewelry. Diamonds, precious and semi-precious stones, rings, bracelets, pendants, necklaces, and a cachet of unique estate items, all quality craftsmanship and prices for every budget. If you're looking for a one-of-a-kind wedding set, a great birthday gift, a meaningful anniversary gift, or something for that special someone, you'll find it at Haney's Family Jewelers. Want to sell or trade your jewelry, stones, or precious metals? You'll get a fair price at Haney's. If you haven't experienced the feeling of having a personal jeweler, you are in for a treat. Visit Haney's Family Jewelers at Power Road and the Santan Loop 202, or call us at 480-279-6688. That's 480-279-6688.
Hi, folks. Rudy Kay here. If you own or manage a business and would like to have your products or service featured on this program, why not contact us and let's see if we can help make that become a reality. After all, Main Street Out Loud is now considered the premier political and issue-driven talk show on weekend radio, and our audiences continue to hit bigger numbers locally, nationally, and even worldwide. We at MSOL are ever mindful that our sponsors keep us on the air, so why not be recognized as a valuable sponsor of this program? Send us an email and let's see if we can't work together to make a difference. Visit our website at www.mainstreetoutloud.com or email us at promo@mainstreetoutloud.com. Our packages include 30 or 60-second ads, web features, links, and much more. You'll be amazed at just how affordable advertising can be on Main Street Out Loud. And that, my friend, is Straight Talk.
$9.99 is more than just the price of a pepperoni pizza. Hi, it's Hugh Hewitt. Herman Cain's Straight Talk and Positive Outlook on America have hit a nerve with conservatives. His new book, This is Herman Cain, is the story of a maverick running for president with a passion for freedom, capitalist ideas. And you can get Herman Cain's book free with your subscription to Town Hall magazine. It's the magazine where thoughtful conservatives will stay ahead of the curve throughout this turbulent election season. To get your copy of Herman Cain's book free with your subscription to Town Hall, log on to townhallmagazine.com. That's townhallmagazine.com.
Lately, it seems everyone's offended about something. Church member, co-worker, complete stranger. It happens all the time to Christians everywhere. But are you blindly walking directly into one of the enemy's most deceptive traps? Acclaimed author John Bevere explains this age-old snare in the million-selling book, Bait of Satan. Learn how to recognize and avoid this damaging pitfall and live free from the deadly trap of offense. Find Bait of Satan by John Bevere, available wherever fine books are sold.
All right, folks, we're back. You're listening to Main Street Out Loud. I'm your host, Rudy Kay. And once again, in studio with us today, we have Dr. Murali Murty, radiation oncologist. We have Dr. Brenda Murty, a breast surgeon. We have Dr. Linda Benederet, a medical oncologist. And we have Dr. Pablo Pritchard, plastic surgeon and breast reconstruction specialist. Now, so let's go on, folks. We have a lot of questions, and we want to take this in some sort of order, and then we'll just open it up. We just asked Dr. Murty, Brenda Murty, surgical treatment options for early breast cancer, and when I asked Dr. Murali Murty regarding radiation. Well, first off, tell us this. When I introduced you, I mentioned state-of-the-art cancer treatment technologies, including IMRT, IGRT, CyberKnife, Linic-based stereotactic radiosurgery. We covered tomosynthesis just a little bit earlier as far as 3D imaging goes, but what are these treatment technology? What is IMRT? What is IGRT?
So IMRT is intensity modulated radiotherapy. All that means I know it's just mumbo jumbo really to the average person, but all that means is we're modulating the beam, a beam of X-rays. Radiation is nothing but a beam of X-rays, and we're modulating that beam to conform to the target to which we're targeting, to which we are at which we're aiming the radiation beam. So it's in the old days we used to use standard blocks, meaning we had a square or a rectangular radiation beam, and we would use blocks cutouts that were cut out in the form of the tumor within the body. But in this case, we have fancy computer technology, etc., that can actually modulate the beam without the need of those clunky cutouts. And the dose is also conforms to the target extremely well.
And IGRT?
IGRT is image-guided radiotherapy. We basically we image the patient or the tumor and the surrounding area on a daily basis. We can do this real time, which means during treatment. There's some ways of doing that. And we can also do it prior to treatment and adjust the patient so that we maximize accuracy. We target the tumor while preserving or saving the normal tissue from exposure to radiation.
All right, we found out that tomosynthesis is 3D mammography.
That's right.
So what is tomotherapy? Is that somehow related?
That's correct. It is related, and so we're using CT scanning. Basically, it's a modified CT scanner. A CT scanner is nothing but a donut-like a structure, and it helps image the tumor. In this case, that CT scanner is modified to treat the patient as well, and it is a way of intensity modulated radiotherapy, IMRT, which we just discussed, but using a CT scanner like device, which is slightly different from standard Linacs, which we use generally.
Oh, it's pronounced Linac.
That's right.
What about cyberknife? What does that mean? Cyberknife.
So a cyberknife is a tool that allows you to do surgery without cutting, so to speak. It is a combination of you can say IMRT and IGRT, but there's also a robotic arm involved that enables the radiation source, which is emitting the radiation to treat a certain cancer, to move with the tumor. For example, if there's a tumor in the chest, in the lungs, you can imagine that as we breathe, the lungs move, and so does the tumor, which is within the lungs. And so how do we know that we're targeting that whole area unless we increase the size of the beam and use large margins, meaning margins around the tumor? So in this case, we are able to target a tumor, a small tumor within, say, the lungs, for example, with very, very small margins, and actually follow the tumor, the movement of the tumor, as it is being treated in real time. So it's a robotic arm, if you can imagine, and as the patient is breathing, the robotic arm is moving back and forth as the patient is moving to follow the tumor within the patient's body and treat it accurately, while sparing normal lung tissue in this instance.
So why? No, listen, not why. Radiation used in cancer treatment, how does it work?
So this is following up on what Dr. Brenda Murty said. In breast conservation, radiation finds its biggest use, most important use, because that's what is the bulk of the cases. And what breast conservation is there's a surgeon goes in and takes out the tumor with some normal tissue around the tumor while saving the breast itself, as opposed to a mastectomy where the breast is completely taken out. However, the surgeon can only remove what he or she sees from the breast, and so there's a chance that there's microscopic disease left behind, which means that it cannot be seen by the naked eye. Even though the tumor has been removed with clear margins, there is a 30 to 40% chance that the tumor can come back, can recur rather in the breast itself. So we are able to use radiation after surgery to address that microscopic disease. So we are able to kill that microscopic disease and reduce the recurrence rate in this instance.
And can that only be eradicated or killed by radiation?
Generally, in that local area, yes. There are some elements. Chemotherapy now has been shown to help with local control as well, and I will let Dr. Benedara touch upon that later. However, radiation is the main way of killing off disease locally, meaning within the breast and the surrounding area.
So I suppose then we could say that as far as radiation goes, do you consider radiation the most important treatment of breast cancer, or to eliminate breast cancer?
No.
Okay.
I think surgery comes first. Clearly, the surgery has to be done, has to be removed. The tumor has to be removed completely with some normal tissue
No matter
around
what,
it.
the tumor has to be removed.
Yes, for a cure, absolutely, it has to be removed. And radiation is an insurance. It's an insurance policy, if you will, to prevent recurrence locally. And then there's also a third element, which is chemotherapy, which I will have Dr. Benedara address.
And that, of course, then we get into the treatment of, or the post-treatment, I suppose, of surgery through adjuvant therapy. Doctor?
That is correct. And adjuvant therapy can be either systemic chemotherapy or hormonal-based anti-estrogen type therapy, or a combination of both.
All right, we're going to talk more with, when we come back, we're going to speak a little bit more with Dr. Linda Benedara, and we're going to talk about treatment of cancer after surgery. So, and we have quite a few questions on that, so we're going to get to some of those that we've received from listeners. So back in a few moments, you're listening to Main Street Out Loud. I'm your host, Rudy Kay, and this is part 2 of breast cancer awareness, and the replays will be available online as of tomorrow on our website, mainstreetoutloud.com. Back in a moment.
There is nothing so sentimental and breathtaking as handcrafted custom jewelry. Whether a family heirloom passed down from generation to generation or a unique modern design, it's special and it deserves professional care. Family-owned and operated Haney's Family Jewelers in Gilbert is the home of custom-designed and handcrafted jewelry. Diamonds, precious and semi-precious stones, rings, bracelets, pendants, necklaces, and a cachet of unique estate items, all quality craftsmanship and prices for every budget. If you're looking for a one-of-a-kind wedding set, a great birthday gift, a meaningful anniversary gift, or something for that special someone, you'll find it at Haney's Family Jewelers. Want to sell or trade your jewelry, stones, or precious metals? You'll get a fair price at Haney's. If you haven't experienced the feeling of having a personal jeweler, you are in for a treat. Visit Haney's Family Jewelers at Power Road and the Santan Loop 202, or call us at 480-279-6688. That's 480-279-6688.
Hi, folks. Rudy Kay here. If you own or manage a business and would like to have your products or service featured on this program, why not contact us and let's see if we can help make that become a reality. After all, Main Street Out Loud is now considered the premier political and issue-driven talk show on weekend radio, and our audiences continue to hit bigger numbers locally, nationally, and even worldwide. We at MSOL are ever mindful that our sponsors keep us on the air, so why not be recognized as a valuable sponsor of this program? Send us an email and let's see if we can't work together to make a difference. Visit our website at www.mainstreetoutloud.com or email us at promo@mainstreetoutloud.com. Our packages include 30 or 60-second ads, web features, links, and much more. You'll be amazed at just how affordable advertising can be on Main Street Out Loud. And that, my friend, is Straight Talk.
Hi, folks. Greg Schulte here. For the past 12 years, I've been part of the Legends Cadillac Express as a customer, a partner, and a fan. What impresses me the most is how Legends has grown from the third best retailer in the Valley to the #1 sales leader in the entire Western region. That's right, the most Cadillacs from California to Colorado. And best of all, they've done it the right way. Legends has the highest combined customer satisfaction rating for both sales and service in Arizona. Now, there's a great combination: trust, respect, and happiness. With the 2011 models going fast, get over to Legends Cadillac and cash in on some great deals. Low finance rates, factory-to-customer rebates, and outstanding lease programs. Folks, it's really all about the people, the location, and the selection. Legends, it's like no place else in North Scottsdale or online at legendscadillac.com.
All right, folks, we're back. You're listening to Main Street Out Loud. I'm your host, Rudy Kay. All right. Back in the studio with us, we have Dr. Pablo Pritchard, plastic surgeon, breast reconstruction. We have Dr. Brenda Murty, breast surgeon. We have Dr. Murali Murty, radiation oncologist, and Dr. Linda Benederet, medical oncologist. And we're talking with Dr. Benederet during the break and talking about the different types of therapies. We have pre-surgical therapy. We have post-surgical therapies. We have other sorts of therapies. Would you expound, Dr. Benederet, regarding what type of therapies there are?
Sure.
And I mean, what type of therapies there are, if we can categorize a couple, three, okay?
After a woman has had a diagnosis of breast cancer, which is obviously biopsy confirmed, a decision is made whether or not to proceed with the initial surgery, which would be either a lumpectomy followed by radiation therapy or a mastectomy. If the patient has a very large tumor, or if she has a worrisome prognostic tumor, such as an inflammatory breast cancer or a triple-negative breast cancer, we oftentimes give what's called neoadjuvant treatment. Neoadjuvant treatment is given before the definitive surgery and radiation therapy in an effort to shrink the cancer. Sometimes it can make a tumor that would not have been amenable to breast conservative surgery now a tumor that is easily amenable to breast conservative surgery and radiation therapy. And it's given for that reason and or to eradicate the cancer cells that have very possibly escaped from the breast prior to the diagnosis. One of the things that we've learned is that medical oncologists look at breast cancer as a systemic disease at the time of diagnosis. And what I mean by that is that there are high rates of cancer cells having escaped from the primary tumor and kind of going into hiding in the body. And the purpose of adjuvant treatment is to try to eradicate that, because women don't die from the tumor in the breast. They die because the tumor in the breast can spread to vital organs and cause the vital organs to fail. So the adjuvant treatment is given following chemotherapy. It's based upon the patient's hormone receptor status, the size of their tumor, whether or not they're positive lymph nodes. In the past, most women were getting adjuvant chemotherapy followed by a anti-estrogen hormonal-based treatment, but today we have testing which includes a recurrence score that allows us to better determine which women will benefit from chemotherapy and which women would do just as well with a hormonal-based anti-estrogen type treatment. And mind you that any type of hormonal treatment in breast cancer is anti-estrogen, and no, women with breast cancer cannot take estrogens ever. So, I want to just clarify that.
Women with breast cancer, though the breast cancer is eliminated, no longer take estrogen?
That's very correct, because we don't know for sure that the breast cancer is, quote, truly eliminated. Breast cancer, with its natural history, can recur 10, 20, even 30 years after a diagnosis. And we know if a woman has a tumor that is hormonally sensitive, i.e. has a positive estrogen and or progesterone receptor, that taking any form of hormonal therapy could actually cause the tumor to grow. So when a medical oncologist or a surgical oncologist or radiation oncologist is talking about, quote, hormonal-based treatment, we are talking about more anti-estrogen medication as opposed to estrogen.
That's a matter of fact. One of our listeners sent a question talking about would like some clarification on the BMI and hormone level that limits choices of post-chemo drugs.
Well, what they're referring to, the BMI, if someone has a high BMI, what that means is that in our fat tissue, there is conversion of a hormone produced in the adrenal glands to estrogen. So women who have a very high BMI might not respond as well to certain hormonal-based treatments because of their mechanisms of action. So a woman who's got a very high BMI is actually at a greater risk of developing recurrent cancer because it's harder to block all of her estrogen that is produced in her body. And we do know that risk factors for breast cancer include, obesity, and that's all related to increased hormone exposure, or when a woman has an early menarche and a late menopause, she again has had increased hormone exposure. So we know that it's very important to try to maintain as normal BMI as you can.
I want to talk a little bit about genetics of cancer as well. I have a question here from a listener that doesn't deal with genetics so much, so I'll save that question for after we come back. But as far as genetics of cancer, there is something that is known as BRCA genetic mutations.
That's correct. There are two genetic mutations. They're called BRCA1 and BRCA2. And these are mutations of tumor suppressor genes. So if you have a mutation in one of these genes, and these genes are dominant genes, the risk of having breast and or ovarian cancer is exceedingly high. And we know on a statistical basis that about 70% of women who have breast cancer just have it. They're one in the unlucky 8 who has breast cancer. We know about 10% of patients who develop breast cancer actually have it because they have a genetic predilection for their breast cancer, and about 20% of patients have familial tendency.
All right, folks, we have to take a quick break. We'll be right back.
There is nothing so sentimental and breathtaking as handcrafted custom jewelry. Whether a family heirloom passed down from generation to generation or a unique modern design, it's special and it deserves professional care. Family-owned and operated Haney's Family Jewelers in Gilbert is the home of custom-designed and handcrafted jewelry. Diamonds, precious and semi-precious stones, rings, bracelets, pendants, necklaces, and a cachet of unique estate items, all quality craftsmanship and prices for every budget. If you're looking for a one-of-a-kind wedding set, a great birthday gift, a meaningful anniversary gift, or something for that special someone, you'll find it at Haney's Family Jewelers. Want to sell or trade your jewelry, stones, or precious metals? You'll get a fair price at Haney's. If you haven't experienced the feeling of having a personal jeweler, you are in for a treat. Visit Haney's Family Jewelers at Power Road and the Santan Loop 202, or call us at 480-279-6688. That's 480-279-6688.
Hi, folks. Rudy K. here. If you own or manage a business and would like to have your products or service featured on this program, why not contact us and let's see if we can help make that become a reality. After all, Main Street Out Loud is now considered the premier political and issue-driven talk show on weekend radio, and our audience has continued to hit bigger numbers locally, nationally, and even worldwide. We at MSOL are ever mindful that our sponsors keep us on the air. So why not be recognized as a valuable sponsor of this program? Send us an email and let's see if we can't work together to make a difference. Visit our website at www.mainstreetoutloud.com or email us at promo@mainstreetoutloud.com. Our packages include 30 or 60-second ads, web features, links, and much more. You'll be amazed at just how affordable advertising can be on Main Street Out Loud. And that, my friend, is Straight Talk.
AM 960 KK&T periodically runs on-air contests. To participate in a contest, you must be at least 18 years of age and agree to abide by and be bound by official contest rules. Employees of KK&T and Salem Communications and participating sponsors are not eligible to win. Official rules available at kknt960.com. Again, that's kknt960.com.
Attention movie lovers! UltraStar Cinema's UltraLux Scottsdale, the exclusive home of pure digital cinema, invites you to see Moneyball, a true story starring Brad Pitt as Billy Beane, general manager of the Oakland A's baseball team, and his revolutionary and budgetary approach to picking players. See it Monday, October 17th, free at UltraStar UltraLux Scottsdale in the Scottsdale Pavilions on Indian Bend and the Loop 101. Visit kknt960.com for details.
All right, folks, we're back. You're listening to Main Street Out Loud. I'm your host, Rudy Kay. Let me tell you once again, real quickly, we're in our last segment of this second hour. We have medical staff with us today. We have a medical oncologist. We have a radiation oncologist. We have a breast surgeon, and we have a plastic surgeon that deals in breast reconstruction. And we're going to talk about breast reconstruction in just a moment. And then we're going to take a few more questions here before we end this program. Let me say real quickly, though, that I cannot thank once again the director of the John C. Lincoln Breast Health and Research Center. The director is Sherry Gage. She is with us in studio. She has helped put this program together both last year as well as this year. Also, I want to thank each and every one of the participants for taking their weekend off to spend time with us and to educate you, as well as hopefully inspire you that you will do those things that are necessary, starting with self-breast examinations and moving on into making sure that you get with your doctor and scheduling mammograms if you're of that age, and or if, of course, you have a suspect that something might not be just quite right. You may hear this program in its entirety, as well as part one that we did last week, by going to our website at www.mainstreetoutloud.com. That's mainstreetoutloud.com. You may send us emails. We will forward your questions on to Sherry Gage or her staff, and you can send those emails to talk, that's TALK, at mainstreetoutloud.com. Now then, let's talk with Dr. Pablo Pritchard for a moment, and let's talk about breast reconstruction, because one of the things that he wanted to, which we just talked about during a break, is that there are some new techniques for breast reconstruction. And I'll just have Dr. Pritchard, what are we talking about, new techniques?
Thanks, Rudy. It's a brand new technique that's out basically in the last year or so. It's called the Miami reconstruction, also known as, it's an acronym for minimally invasive autologous mastectomy incisionless reconstruction.
Yeah, Miami's a little easier.
Yeah, Miami's easier, yeah, exactly. But basically what that means is it takes the reconstructive process and simplifies it. So instead of a big, huge surgery that's done for reconstruction, we do outpatient surgery procedures. So that's number one. That's a kind of a nice
surgery.
Outpatient surgery, exactly. What we're doing is we're putting external tissue expanders on the patient, and this is basically, it sounds kind of crazy, but it's a suction cup type of apparatus that the patient uses at home only at night when she's sleeping. And it's minimal suction. It's minimal suction over a long period of time just while she's sleeping at night, which basically just stretches the skin a little bit. And then what we do is we take fat from somewhere on her body, do a little liposuction, and usually ladies are not too upset about that, and take that, purify that fat, and inject that fat in a very specific, special way into the chest area to recreate the breast tissue. And it forms a really natural result. And not only does it look natural, but it feels natural. And that's some of the problems with some of the other types of reconstruction, especially if you're dealing with, for instance, implants in a radiated field, or you get to kind of a harsh-looking, firm breast. And this is a very, very soft result, which is really nice. And it's a departure from some of the other autologous reconstructions. Autologous basically means your own body's tissue, in that those other types of reconstruction, whether it be a muscle flap from the back that's used to recreate the breast, the tissue from the abdomen and the muscle to recreate the breast, or just simply what's called a deep flap, or the fat overlying the abdomen connected to a little artery and vein, and using that to reconstruct the breast. Those are all much longer procedures, and they can also cause some morbidity to the patient. The patient loses some function in those type of procedures. And in the cases of the more extensive surgeries, they're in an ICU for a couple days, etc. So this type of procedure gives a really, really, really nice result, and it's outpatient surgery.
Outpatient?
Yeah.
Unreal. I want to go back to for a moment with Dr. Benaderet and talk about molecular tumor profiling. Would you tell us what this is new? So in oncology. So what are we talking about here?
This is very new and exciting, and it is done in Phoenix. It's done at TGen. Molecular profiling is when you actually take a piece of the patient's tumor and you test it for specific drugs. And different chemotherapeutic drugs have different mechanisms of action. And we can identify certain tendencies of a particular patient's tumor so we can better identify what class of pharmaceutical drug would be best for them. So it allows us to give a more directed therapy. Molecular profiling is, I think, the wave of the future in oncology.
We talked earlier, off air, we talked about, I had a lady that was taking a particular drug and is coming off of this drug after about 8 years of use.
You talked about tamoxifen for 8 years. And generally, unless someone has advanced cancer, tamoxifen is given only for 5 years, and it can be used in both pre- and postmenopausal women. But the benefit from tamoxifen when it's used adjuvantly, that is in addition to the major surgical approach to help eradicate any possibility of recurrent cancer, the benefit is really seen in 5 years, and after 5 years we see just more toxicity than additional benefit with tamoxifen. But we do know that if we follow tamoxifen with an aromatase inhibitor, if the woman is postmenopausal, that sometimes those patients who have 5 years of tamoxifen followed by 5 years of an aromatase inhibitor can actually do better than if they are treated with 5 years of tamoxifen alone.
And Dr. Murty, we talked about surgical treatments and breast cancer and whatnot. We always hear about the lump as being a potential sign of breast cancer. Are there any other physical changes in a woman's breast that should be a signal for her to seek medical attention?
Absolutely. Doing your breast exam, self-breast exam, is very important because it gets you get to know your breasts. And so if there's a change, you would know that. I call it the ABCDs of doing your breast exam. So A is asymmetry, meaning in one portion of generally we're symmetrical. So if you feel some thickening in one part of the breast and it's not there on the other side, then that's something that you would note. Or B, or bumps or lumps, as we all know about any lumps that you feel you should seek medical attention. Or C, any color changes. So if you're looking in the mirror and you notice that your breast is red or thickened, sometimes that can be a sign of very advanced breast cancer, like inflammatory breast cancer. Or you see crusting around the nipple. That can be a sign of very rare breast cancer called Paget's disease. And then D is discharge from the nipple. Although most nipple discharge is physiological, there can be worrisome nipple discharge where it's from one breast, one duct, and can be either dark colored or even clear. But the key is that it's from one breast and it occurs on its own, not with stimulation. So there are other signs and symptoms that people should certainly look for.
And when you spoke of the inflammation, sometimes there's heat associated with with these coloring or the rash type effect or redness and
Sure.
whatnot, right?
Yeah, so people who have the inflammatory breast cancer or redness or thickening of the breast tissue certainly can initially be confused with infections. But if something's not responding to antibiotics, then you should seek medical attention.
Just all of you, would I be wrong in saying that through a self-breast exam, that when a woman does a self-breast exam, if she feels something that just wasn't there last week or the last month, is it too much to say you need to go see a doctor at that point? Is that too alarming, an alarmist attitude?
No, not at all. I think it also depends on the age of the patient. So if someone who is younger feels that something is different, I think that it's reasonable to watch it through 1 or 2 menstrual cycles and see if it goes away. And if it does not change with menstrual cycles, then it's absolutely necessary to see your primary care doctor or a breast surgeon.
Also, a question back for Dr. Pritchard. Dr. Pritchard, had a lady say that she was under the impression that breast reconstruction, had a size limit, and that that limit seemed to be, according to what she was told, a B cup, and therefore some people are not a candidate for breast reconstruction. Is that a fact?
No, that's absolutely incorrect. Whether she's a size AAA or a size E doesn't really matter. And a lot of the times when we do breast reconstruction, we change the opposite side, or if she didn't have bilateral mastectomies, in other words, if she had both breasts removed versus one breast removed, if she still has her natural breast on one side, we can change that breast to the desired size on the other side too. So a lot of the times the ladies are even happier with their breast size after surgery than they were before.
Then here's a question one asked, that if an individual had a sentinel node study, they input a metal marker, can they have an MRI after that?
I think what they're referring to is a needle biopsy, and every time a needle biopsy is performed, so what that means is that either on a mammogram or on an ultrasound there is some abnormality that's seen, and we will biopsy that using a needle biopsy. So when we do that, we always want to know where we were, and so we will put a titanium clip in that spot. And
that's what they're talking about, the metal marker.
Correct.
Oh, okay.
And so you certainly can, those are all MRI compatible, and you don't go off at the airport either. So.
All right. We only have a couple of minutes left. Let me ask any of you, each of you, what is it that you would like people to understand from this broadcast? What do you want them to know?
I would like women and men to know that if breast cancer is caught early, it is generally curable, and to be aware of your bodies, and if there's something that's different, don't just brush it off. You need to seek medical attention, and if you don't have insurance, you still need to seek medical attention, and most physicians will try to work with you. It is just horrible for us to have women come in who've had an abnormality that they've known about for over a year, and they come in with a locally advanced breast cancer, and they haven't sought attention because they don't have insurance. And please, there's always a way, and do take the best possible care of yourself.
Yeah, I want to add to that. It's it's always surprising to me that women come in not having had mammograms for several years, and a lot of times they're busy taking care of spouses or children, and they just forget to take care of themselves. But always remember, you're just you need an annual mammogram, and you need to take care of yourself first.
All right, and then yes, doctor.
I also wanted to add that once the cancer is detected, breast cancer does not mean a mastectomy automatically, and that a breast can be conserved with surgery followed by radiation therapy, which is equivalent to a mastectomy. So it's important to note that.
All right, folks, we have absolutely run up against the clock. I want to thank each and every individual that was here today